Ludigi. Ooh.
What's that on that beat? Oh.
It was at this moment Hayes knew he done fudged up.
Oh gosh, I think I'm bleeding.
Sir, are you okay?
Yeah, I think so. I've got a condition called hemophilia.
Oh, God.
It affects like 20,000 U.S. Residents, and it usually affects mostly men because it's on the X chromosome. But it means that like my blood doesn't clot very well.
Oh, God. All right, well, here's the towel, Hayes. You can tell me more about it.
All right, thanks. So my disease is a common hereditary disorder caused by a deficiency of clotting factors 8 and 9. Which can lead to chronic disease and lifelong disabilities if it's not treated properly.
Wow, Hayes, that sounds very serious. How many people have this condition?
So there's two types. Type A, 1 in 5,000 people in the United States have it, and type B, 1 in 300,000 have it. And typically 2/3 of the people that do have my disease have the severe form of it. So type A is caused by a deficiency in clotting factor 8, and type B is caused by a deficiency in clotting factor 9.
Wow, Hayes, this sounds pretty serious. I know I think my friend actually has that too, and he really complains about bleeding at the joints and like soft tissue. He also complains of pain, muscle atrophy, contractures, nerve damage. I think like the serious complication, especially when you're like 1 year old, is intracranial hemorrhage. It's a big problem. And some of the impairments, my friend said, you can have decreased range of motion in your joints. There can be some mental impairments, coordination, gait difficulties, visual, general motor. My friend also has ADHD, which in the hemophilia population, it's a little bit more of a proportion. So we should probably fix that bleeding neck of yours.
Yeah, I probably won't go to the ER. I'll just go to my doctor and PT. Is this Miss Dr. Yu's office? Oh, Dr. Yu. How are you doing today?
Oh, how you doing today, young man?
Good, doing quite well.
Why don't you take a seat? Let's take a look at you.
All right, Dr. Yu, I fell the other day and I kind of hurt my knee, and I also cut my neck pretty badly. I was just wanting to come in and get a checkup about my hemophilia.
Okay, well, I have some great news for you. Usually around 70% of patients with severe hemophilia all survive. Unfortunately, there's a very small percentage of those patients who have trouble with motor cognition and some learning disabilities. However, with the appropriate education and treatment, patients with hemophilia can now lead a very fulfilling and productive life. Fun fact, did you know that the original life expectancy of a patient with hemophilia was only 11 years old?
Wow.
But now, thanks to medical advances, the life expectancy of patients with hemophilia is only 10 years less of those of a healthy adult.
Oh, thank goodness.
That's crazy, isn't it?
It's terrifying.
Great outlook for you, bud.
So while I'm here, I figured I'd ask, I was just kind of curious, how do you guys know if somebody has hemophilia?
Well, there's a couple of diagnostic procedures that we go through. The first one is we take a look at your medical history. The second one is blood tests. And what these blood tests can tell us is we can take a look at these results, and these results can help us determine the amount of delay of blood clot formation. The second one we can take a look at is your clotting factor. Clotting factor tests are used to determine the levels of clotting factors and can help determine the type and severity of hemophilia that the patient can have. Depending on the levels of clotting factors 8 and 9, hemophilia A and B are classified as mild, moderate, or severe. So usually in healthy people, the level of clotting factors is between 50 to 100%, which is pretty high if you think about it. However, in people with mild hemophilia, the level of clotting factor is only between 5 and 50%. It's getting lower and lower. And then in people with moderate hemophilia, there's only about 1 to 5% of clotting factor levels. And when it comes to people with severe hemophilia, only less than 1% of clotting factor levels are present. So based off the results of these tests, we can determine what kind of hemophilia the patient has.
So are you still going to give me some of those meds that you typically do? What do they actually do for me?
Yeah, so the medication that I usually give you all help promote blood clotting, or they also help increase the levels of plasma in your body. Or we can also switch to a replacement therapy where we actually inject concentrations of clotting factors 8 and 9 into your body to help raise up those levels of plasma.
Awesome.
Yeah, so why don't we go ahead and give you your pill for the day. All right.
Well, thank you.
There we go. All right.
So what about my leg? I kind of hurt that when I fell. Is there anything that you can do for me there?
Yeah, I'm gonna refer you to a PT because you should always choose PT.
It's the one and only Digo Double G. Snoop Dogg. You know I'm mobbing with the D.R.E.
Hey Justin, it's Cindy. Can't get the smart board to work. I got a patient coming in at 2:30, and just trying to show him some exercises that we're gonna learn today. So just give me a call back when you get this message. Thanks, bye. I think our 3:30's here. Let's go see if he's out there. Hayes Barnett, okay?
Oh, that's me.
Oh, hey, how you doing, Hayes?
Thanks. I'm doing
I'm Lucas. I'm your physical therapist.
Oh, it's nice to meet you.
Nice to meet you. So, heard you had a little fall. So tell me what happened with that.
So I was just strolling around my apartment complex, and I wound up falling and hit my neck pretty bad, and I cut my neck, but I hit my knee,
Okay.
and it's been bothering me a little bit.
Oh dang. Let's take a look at it. Now, did I hear correctly that you have hemophilia? Is that
Yes.
okay? So I got that from the doctor. So I assume that he cleared everything there as far as like muscle bleed and joint bleed and that type of thing. Okay. So what my job is to do for you is we're just going to go through and work on your leg to get you back to the level you were before your fall. Okay. So some of the things that I can help with is I can help you become more flexible. I can build those muscles in your leg there and improve your coordination, and we can get you exercising, which will get you quite a few benefits there, okay? Also what we can do as a physical therapist, we can, the stronger we get your leg, it can lead to like increased protection of your joints and a decrease in hopefully your any bleeds you may potentially have from like falling and things like that. So the stronger we get you, the quicker you can recover from any type of falls and fewer issues you're going to have down the road, okay?
Okay.
So the doc diagnosed you with a iliopsoas bleed. So you have the iliopsoas running from up here all the way down your leg. And also you have a joint bleed. So you kind of got a double whammy going on right here. So we're going to have to work on that quite a bit. When was your injury?
It was just a couple days ago.
Okay, so right now you're still in the acute stage. So what we're going to work on now is just like typical, just what we call RICE. So we're going to rest it, we're going to ice it, compress it, and elevate it because you know, we're trying to get the healing process to begin right now. So.
Okay.
So also during the acute stage, depending on the age of the patient and their ability to walk, some patients may require an assistive device like a walker or a cane. And also during the acute stage, you also might have to, you also can use like modalities such as diathermy and ultrasound for pain relief as well. Although ice is shown to be the most effective in treating hemophilia just during the acute stage. So as our like main focus as physical therapists working with patients with hemophilia, we just want to focus on the physical aspects of life with the bleeding disorder. We want to help create activity plans and exercise plans that are like modified for every patient and specific to them. We're there to help with rehab when needed, like in Hayes' case, And we can also help patients prior to surgery if they're going to receive like a knee replacement, and then also help with rehab following surgery as well. Other issues that patients may see other reasons physical therapists may see patients with hemophilia are for, in addition to muscle bleed and joint bleeds, which are the most common, also are like surgical synovectomies as well as total knee joint replacements, usually the knee. The main focus is just the overall maintenance of healthy joints and the muscles, and that is crucial to improving the patient's quality of life. And also education is huge as well regarding like physical activities. So also from the subacute phase moving forward, we just want to be mindful that all the exercises we perform with patients needs to be in a pain-free range. And like we were doing earlier, we want to work the antagonist muscles. So like in the case of an iliopsoas bleed, you want to work the glutes and as well as the abdominals as well. As pain continues to decrease, we can move on to more standing and weight-bearing exercises, more strengthening and weight transfers as well.
I do have a question.
Yeah, go for it.
In a couple weeks, I have a semi-pro stray cat wrangling tournament coming
Oh, I've heard
up.
about those.
Yes.
Yeah.
Hopefully, maybe you can come.
Nice.
But I just have a few questions. Like, when, can I start that now, or should I wait? Or
Oh, okay. Well, I should have told you earlier, and we'll just go over the activity and participation limitations you're facing with your injury. I'm sure you've been told before, as you've lived with hemophilia your entire life, but often patients with hemophilia can participate in a wide variety of sports, including cat chasing, wrangling,
Awesome.
who I'm a big fan of, and that gets you going. And you're encouraged to participate in sports like those to reap those benefits, such as, like we talked about earlier, improving flexibility, maintaining your joint health, improving proprioception, just overall general fitness and mobility as well. So in the top, I'd say there's about 10 activities I would recommend. You can participate in things like swimming, table tennis, walking, fishing, dancing, badminton, sailing, golf, bowling, cycling. Those are just a few.
Awesome.
And there's some you should definitely avoid. Although cat chasing isn't on that list, I just want you to know a couple that tend to be more like high contact sports. So things like boxing, rugby, soccer, football, karate, wrestling. I just want you to avoid those type things moving forward, just because they increase your likelihood of becoming injured and hurting your leg again. So.
Do you want me to go talk to the front desk lady and get scheduled for tomorrow?
Yeah, that'll be good right there.
Okay.
And can I get a oh yeah before you leave, please?
Oh, yeah.
Oh yeah.
She say, do you love me? I tell her only partly. I only love my bed and my mom, I'm sorry. 50 dub, I even got it tatted on me. 81, they'll bring the crashers to the party. And you know me, turn the 02 into the 03, dawg. Without 40 Ollie, there be no me. Imagine if I never met the broskies. God's plan, God's plan. I can't do this on my own, hey, nope, hey. Someone watching this shit close, yup, close. I've been me since Scarlet Road, hey, hey. Might go down as G.O.D., yup, wait. I go hard on Southside G, hey, wait. I make sure that Northside E, yeah. And still.
Being active is one of my passions. It's a stress release, my therapy. Although I live this active lifestyle, most people don't know that I have extreme hemophilia. When I was 2 weeks old, I had my circumcision, and doctors couldn't stop the bleeding, and they diagnosed me. Hemophilia is a blood disorder where my blood doesn't clot, and I have the extreme version. I definitely remember getting hurt a lot as a kid, and some injuries put me out for quite a while. I didn't think a lot about the long-term effects of these injuries and how they would affect me later in life. When I was 16, I had an iliopsoas bleed while I was wrangling some feral cats, and it made me think more about how my future would be affected. I began to work more with my doctor and not against him. I would treat injuries before I felt the pain and not after. You really have to communicate with your doctor and stay up on your treatment. I never felt sorry for myself throughout it, thinking, why me? I never let it control me and tried to own it. You need to stick to your treatment and make sure that certain activities are okay prior to doing them. I realized that you don't have to let hemophilia control you as a person, and that you can define your own path and live your own life in a fulfilling one.